Maternal mental health is an area of concern.
1 in 2 women is suffering from mental health disorder. A physical assessment is done, but a mental health assessment is not done. From the low and middle income countries, we find that the antenatal depression is at about 25%. And postnatal is at 19%, which means antenatal depression is much higher. Symptoms of being pregnant are similar to that of being depressed.
What is stopping our society to address this issue?
Perseverance to stress बढ़ाओ सब ठीक हो जाएगा. And that is the worst advice that you can give.
Welcome friends to another episode of Medicine Unmasked. We celebrate World Health Day. कुछ ही दिनों पहले मैं सोच रहा था कि हम ये हेल्थ डेज सेलिब्रेट करते हैं, इनका महत्व क्या है? इनका महत्व है कुछ ऐसी चीज़ों को डिस्कस करना जो कि हमारे समाज, हमारे कम्युनिटी के लिए बहुत इम्पोर्टेंट बन गए हैं. ओवर द ईयर्स प्रेगनेंसी हैज़ बिकम अ चेरिश्ड टाइम फॉर एवरी मदर. It used to be a burden, it used to be thought about as a disease. But unfortunately, the facts are very, very different. Maternal mental health is an area of concern for every woman in the 21st century, and so it should be for our community. I have today a very distinguished guest, a speaker who's researched about this. She has done a PhD about this. She has devoted a significant portion of her life to this cause, and it is very close to her heart. So I welcome Dr. Sheenu Jhawar. Thank you.
Thank you. Pleasure to be here.
So, Dr. Sheenu, again, I think this is something it's very close to your heart. 1 in 5 women, as per the data, have maternal mental health issues. Why is this not being discussed? Why is it not attracting enough attention? Why are we as a society not able to highlight it enough?
So, it's very interesting that you say that 1 in 5 women have the mental health issues amongst the women. But you'll be surprised to know that this is just the data which has been captured. This is not the real picture at all. Plus, the data that you've just cited is the average. It's only for those countries where some sort of a screening and diagnosis is taking place and people are aware about it. But if there is no clinical protocol at the time or beyond the period of pregnancy to actually monitor if the woman is going through any mental health disorders, then we do not have that data. So 1 in 5 is a very, very skewed number, only picked up from certain countries. And you would be very, very surprised to know again that the PhD which I did for the prevalence of maternal mental health in Rajasthan, so we figured out that 1 in 2 women is suffering from mental health disorders, and some were on the brink of wanting to commit a suicide. So there were a lot of ethical issues around it as well, and we gave this information back to the doctors for them to take this up. But this is a very, very highly concerning issue. Now, enough attention is not paid to it because there is no mandate to diagnose the women or to do any kind of a screening when they come for the antenatal healthcare checks. In fact, my question back to the audience, and I'm sure a lot of people who are in the advisory stage, who do policy advocacy, who are doctors here, they also must be watching your very, very brilliant podcast. And my question to them is that when a woman walks into the antenatal health clinic, a physical assessment is done, but a mental health assessment is not done. So are we saying that wholesome health is only restricted to physical attributes and not mental well-being? I think that is the question that we need to ask ourselves. Also, it is not about whether this is increasing, but my concern would be with whatever is the burden of this disease as of today, what are we doing about that? Forget about whether it's increasing or what is the extrapolation in terms of numbers, because even today, with the burden as it stands, we are not in the right capacity to diagnose or to provide the treatment which is required.
So again, I think a very interesting perspective सो सम स्टडी शोज 20 to 30%, बट जैसा आपने बोला कि राजस्थान में जो आपकी स्टडी है, जो राजस्थान के डेटा पे आधारित है, उसमें करीबन करीबन 50% वुमेन एक्सपीरियंस. बट you know I feel, as you said, this number is increasing. Are we looking at only the tip of iceberg? But I feel we are living in a socially connected world. Everybody is available. Access to healthcare is improving, definitely, at least in the urban areas. Then why is this number increasing? And in today's area when access to at least urban population के तो मैं बोल सकता हूँ कि hospitals का access.
So, very interestingly, we always talk about gender bias and we say there should not be any gender bias. But in this situation, genetically, there is a huge gender bias. So, you would be again amazed to know that the burden, as per the WHO, the burden of depression is 50% more in females than it is in males, genetically. So they're far more predisposed to this. Plus, the reproductive age of a woman is the phase of the highest possible risk of depression. So I think there are a lot of genetical issues at place and a lot of other social issues at place. While the world is becoming a global village, but I think the people in the village are going a little far apart. And in the absence of these and a lot of other things, we find that this problem is escalating. Also, I would go as far as to say that is it really escalating, or because we've started paying attention to it in some respect in some countries and started collecting the data, so the data appears to be in absolute numbers very, very large. But maybe this was already always existent because there is a prevalence data and there is the incidence data. So the incidence data, as all of us understand, is about new cases happening over a period of time. The prevalence is the current burden of disease which exists at any given time. So there is an increase. There is a lot of screening being done in certain countries. So we're coming to know more about this problem. But definitely there is a very, very high risk in the women in the reproductive age. Now, another very interesting research is that in the low and middle income countries, the antenatal depression, in fact, and I should talk about antenatal and postnatal also at this point. So while the complete burden of disease is in the perinatal phase, which consists of the antenatal period, which is when the woman is pregnant, and the postnatal, which is after the delivery of the child, but the depression in both cases is significantly high. Antenatal becomes more difficult to address because in that stage you cannot give medication to the women. Also, a lot of symptoms of being pregnant are similar to that of being depressed. And research points it out and breaks it up into various parameters, which we will not go into right now because that forms a far more focused scientific study. But because of these issues, we are not able to discriminate whether the woman is depressed or not. Again, there are screening methods for it, which we do not use. But the fact of the matter is that if a woman is depressed in the antenatal stages, it becomes a precursor for the woman to be depressed in the postnatal stages. Far worse, the child, the fetus, carries this genetically. And if it's a female child, then when they have a child, when they become pregnant, they could also be depressed. So imagine, apart from the social factors, there's a lot of genetic factor at play here. From the low and middle income countries, we find that the antenatal depression is at about 25%, and postnatal is at 19%, which means antenatal depression is much higher, again, with the fact that we do not screen enough. And the World Bank data also shows that the research and the treatment in the low and middle income countries is much lesser than what is required.
So again, I think antenatal ज़्यादा है, हम maternal assessment definitely improve कर सकते हैं, and postnatal भी है, and definitely, as you said, highlighted, it probably इसका प्रभाव शिशु पे या जो पड़ता होगा. Now, if you can highlight, because you've studied this topic so much, so let's say 50%, 70% of women do not get access. Again, there is a societal bias. हम माने या नहीं माने, there is a societal bias, there is a genetic bias. Again, I think as an individual, we might not be able to influence that so much. But you are a person who's probably, known healthcare, done a lot of research, and then obviously been a mother yourself. From all the डायमेंशंस, ऐसा क्या है कि लोगों को मेटरनल मेंटल हेल्थ का एक्सेस करने के लिए या अपने डॉक्टर के पास में जाने के लिए, व्हाट इज स्टॉपिंग आवर सोसाइटी टू एड्रेस दिस इशू?
So the biggest thing is the stigma around it. Uh, अगर हम सिर्फ प्रेग्नेंट लेडीज़ के बारे में बात नहीं करें, मैटरनल मेंटल हेल्थ के बारे में बात नहीं करें, केवल नॉर्मल मेंटल हेल्थ डिसऑर्डर के बारे में बात करें, उसमें भी देर इज़ अ वेरी बिग स्टिग्मा समवेयर देयर. You have to tell people that if you have a kidney problem, does it stop you from seeking help? If you have a cardiac problem, does it stop you from seeking help? There have been instances, and people have narrated this personally, that somebody was talking about a mental health disorder within their family, and somebody else who was sitting with them, they held their hand and they said, "Chinta mat karo, thoda sa apna perseverance to stress बढ़ाओ, सब ठीक हो जाएगा." And that is the worst advice that you can give. And again, my question is, if you have a respiratory issue, does that get better because you increase your perseverance to stress? No. You need a medical diagnosis for it. You need to go to the right people for it. Similarly, the brain is an organ. And like I said, there could be a lot of factors beyond even our understanding and our control that lead to the malfunctioning leading to a mental disorder, which can be depression, anxiety, stress, it can be schizophrenia, and so on and so forth. Again, you will be surprised. Climate change is a very, very big reason for mental health disorders. Heat is a very big reason. Air pollution is a very big reason. And for all of these things, there is a doctor in place, there are counselors, there are psychotherapists, there's a whole gamut of people in this value chain who are there to look at you, diagnose the problem, and give you the right treatment. And those are the people that you need to go to. इसीलिए मैं कहती हूँ कि सबसे पहले हम सिर्फ इसके बारे में बात करना शुरू करें. Let's just talk about it. If we talk about it, it gets mainstreamed. When it gets mainstreamed, people are not intimidated. उनके अंदर हिचक नहीं होती कि वो जाकर के अपने परेशानी राइट पर्सन से बात करें और उसका ट्रीटमेंट लें. Take that first step forward.
So, I think you rightly mentioned, आपने बोला कि antenatal time में भी, and I think even if you are thinking about motherhood, all these factors can lead to some form of unfavorable events during your pregnancy, whether it is premature birth or low birth weight. And as a country, we're talking about a $30 trillion economy and a Viksit Bharat, and we think our strength is the future or the children.
Yes.
अगर हमारे फ्यूचर का 50% जो पॉपुलेशन है या जो फ्यूचर है इंडिया का, अगर वो किसी भी कारण से इन सब चीज़ों से अफेक्ट होगा, तो हाउ कैन वी kind of country can deem for Viksit Bharat, and then we have this problem. So as you said, there is health that is available, people need to talk. बट हम इन दोनों चीज़ों को जब तक नहीं जोड़ेंगे, या मैं आपसे कुछ क्वेश्चन पूछूंगा, हम इन सब चीज़ों को जोड़ कैसे सकते हैं?
So that's a great question, and I know that you come from a very established organization. I think both of us do, and we all do, whoever are here. And I think the first step is within our house, obviously, but then that is a low impact scenario. We are all living in nuclear families. The next step is the community, but the biggest is the organization that we come from. And then we see what is it that we can do in our organizations to help the people. That is taking an immediate hyper-local step, because we cannot change the entire country by saying that, okay, today I want to bring about a change for India. But if we bring about a change in our organization, and if a lot of us decide to do that, then automatically the country is going to change too. So, when we talk about the reasons, again, it can't be something which is a hearsay or something which I've observed around my surroundings. I've been continuously saying that this is scientific, it is data-backed, it is research-backed. So if we look at the systematic reviews, which compile data from a lot of large studies instead of looking at just one study, which can just be of a particular place. So I'll cite a study. It was a systematic review which was conducted on selected 57 articles from 1980 to 2008. And the purpose was to identify the correlates of depression. So once we understand the possible correlation, then we can work on those parameters. So, certain things which were identified were life stress, where life events referred to events that are psychologically significant in a person's life, such as death, divorce, lifetime depression history if they've been already diagnosed, lack of social support, very, very important, whether from the partner or from the family. In fact, this is one of the strongest factors for depression. Domestic violence as one of the factors. Um, Issues with intimate relationships, socioeconomic status, and in certain cases, females not having the desired insurance, which is again, if they feel that they have a financial difficulty ahead of them, that can become a precursor for depression or a mental disorder. So these kind of things are regularly being identified in the world. If we look at these scientific studies, we find that while we cannot provide the treatment, but number one, can we make it mandatory? Just as health, a lot of organizations make the health check mandatory. Can, as an organization, we also involve mental well being? And I'm not going to say mental disorder, again, because of the stigma, which we're trying to eliminate. But as a first step, are we mentally well? And there are tools for ascertaining that. Can we take help of a healthcare organization to ensure that? That is the first step and make it mandatory for all our people, which also means we are regularly talking about it, which means there is no stigma around it, which means we are openly accepting that there is a concept such as mentally not being well, and we would like to screen for it. Once we screen, can we also ensure that we have the right showcase and the first, second, third step in this value chain of seeking treatment if somebody is recognized as not being completely mentally well? The second point is uh, if there is a lack of social support from within the confines of the family or from the partner, we are no one to judge that. But can we still ensure a close net social support system from within the organization for our people? So, something that we set aside at Apex was a Talking Friday. So, we said this is a room and this is a couch, and some of us are available just to listen to you. And there, the relationship between the people who want to walk in on a Friday and just talk their hearts out, the relationship between them and certain people who were oriented to listen in an unjudgmental format, there can be no system of hierarchy there, and people just have to be listeners and people can come and talk to them. So I think speaking to people also gives you the perception that you have a support system around you. Very interestingly, nutrition is a very, very big correlate with depression. So, ensuring that the right information is disseminated to the people in the organization as to what is a balanced nutrition, and if we can hold special days in the organization to recommend that, I think that is very good. So these are some of the things that we can take care of. Air pollution, if people are sitting in close confines, how do you make sure that the air is fresh and healthy? There is a concept of green buildings now, which ensures that people live in a surrounding which helps them feel better mentally. So I think these are some of the things that we can do for our immediate hyperlocal audience.
So, I think this is a problem that I think society as a nation, again, as I said, it has to go hand in hand, and you've addressed it very nicely at kind of layer by layer. बट एक इकोसिस्टम में आज भी वी आर अ फैमिली सेंटर्ड कंट्री सो आई थिंक एजुकेटिंग द फैमिली इज प्रॉब्ली द मोस्ट जैसा आपने बोला हाइपर लोकल अप्रोच सो फर्स्ट ऑफ ऑल how do we identify? So, can we at least talk about it at the time of, maybe as when they seek an antenatal appointment? Can the like ultrasound? I think has become more and more synonymous that people want to come, people want to know. There is an entire family that wants to know. There is an acceptance, yes. तो इस पूरे टॉपिक पे फैमिली के इकोसिस्टम में अवेयरनेस और एक्सेप्टेंस कैसे आ सकती है?
So, you've sort of hit the nail on the head because that is really where the problem starts from. Because when the woman faces it, she can't even imagine that there could be a problem which is associated with the phenomena of being pregnant. That's like a blow to her. while she's trying to understand her own situation and she's really, really confused, and especially if she's a first time mother, the family around her is also confused. So, you've really given a great idea that at the time of sonography, where somebody definitely assists the mother to be, I think some sort of an orientation or a FAQ should be given to them. So you're not telling them that, look, this could be a potential problem, because that could also trigger some sort of an anxiety in the mother. Because, I mean, for the same reason that you don't tell a mother that there could be a preterm baby, right? You just tell them that you need to go through all of these checks to make sure that you're well and the baby is well. So I think at that time, कुछ फ्रीक्वेंटली जो आंसर्ड क्वेश्चंस होते हैं वो, या कुछ रीडिंग मटेरियल, या आपके जो टीवी स्क्रीन्स पे आजकल हॉस्पिटल की इन्फॉर्मेशन चलती रहती है उसमें कुछ चलता रहे. सो पैसिवली इनडायरेक्टली यू मेकिंग द पीपल अंडरस्टैंड कि ये भी एक चीज़ है, और हमें अपने ही फैमिली के मदर टू बी की हेल्थ के लिए और बच्चे की हेल्थ के लिए शायद ये स्टेप्स भी लेने चाहिए और डॉक्टर से बात करनी चाहिए. आई थिंक दैट कैन बी द स्टार्टिंग पॉइंट. दैट्स अ ग्रेट ग्रेट आइडिया इन फैक्ट.
Another aspect of the the mother, expectant mother, is I feel I often speak to friends and colleagues wife who are pregnant, or there's a certain stress about, if they are very very motivated professionally, they want to continue, they don't want to take any time off, and uh, I apparently, as per our data, 60-70% of females find this time to kind of juggle both things. Like, घर भी manage करना है, खुद को भी manage करना है, and there is another person who you have to manage. So, how about this workplace environment? We talk about it. There is some awareness, but on a large scale, let's say in our organization or any other organizations, what do you think the industry can do? What is it doing actually? People like me might not be aware. So can you just talk about it?
So I'll give you a data first. A survey in India was done, and they found that only 45% of the women receive paid maternity benefits, maternity leave benefits. So while we are talking about this, 50% of the nation's population and their possible significant contribution to the GDP of the country, we have to understand that there is no take without a give. And we cannot expect them to be fully involved in their work if there are issues around how better they can contribute to their work. And one of the things is that women, this is a legal thing, women deserve it. So, maternity leave benefits, of course, are a very important part of the organizational corporate governance, which organization should focus on. Secondly, I think flexible working and part-time working, those are another options that people could focus on. In fact, some startups have actually come up with aggregating a pool of women who can give certain time only towards their work, and but then they work like locums. So I think that is something that we can pursue again as organizations. You can't say no to this force to reckon with in terms of how much they can give, but we'll have to be sure that we give them all the right benefits from the organization's perspective. And every organization has an active HR department, and the right people to build some sort of a structure where these points are taken care of.
So I think we've एक काफ़ी डिफरेंट पर्सपेक्टिव से हमने एक ग्लोबल पर्सपेक्टिव से बात करी, हमने एक राजस्थान के पर्सपेक्टिव से बात करी, हमने एक घर के पर्सपेक्टिव से, सोसाइटी के पर्सपेक्टिव से, एज ए हेल्थ केयर ऑर्गेनाइजेशन के पर्सपेक्टिव से, एंड देन वर्क प्लेस के पर्सपेक्टिव से बात करी. बट देयर इज स्टिल समथिंग दैट it's left about the lifestyle, about nutrition, about I think now like iron supplementation is kind of talked about. How can all these things can be, ये कैसे स्ट्रक्चर कैसे हो सकते हैं ताकि हम ये एक्सेस, अगर हमारे को मटर्नल मेंटल हेल्थ पे इम्पैक्ट करना है, फ्यूचर बच्चों के फ्यूचर पे इम्पैक्ट करना है, देश की इकोनॉमी पे इम्पैक्ट करना है, तो हाउ कैन वी बिल्ड दिस प्रोग्राम्स इवन मोर स्ट्रॉन्गर?
No, you're right. So a lot of again research has gone into it, and daily कुछ ना कुछ हम नया इसके बारे में जानते हैं, because ये नहीं कहना चाहिए कि sunrise industry है. I mean it's not something to be proud of, but definitely this is on the radar of all researchers now, because this is one of the leading causes of disability adjusted life years in the world. So हमें ये समझना चाहिए दैट जितने भी पैरामीटर्स आज तक आइडेंटिफाई हुए हैं उनके अलावा भी बहुत कुछ है और उनके बिना भी ये होगा. दैट इज़ द बिगेस्ट लर्निंग. आज हम अगर कैंसर की बात करते हैं, कार्डियक डिजीजेस की बात करते हैं, समटाइम्स वी एंड अप सेइंग दैट द पर्सन यूज्ड टू एक्सरसाइज अ लॉट. They did not have, let's say, red meat. They had a very balanced, disciplined lifestyle. How come they had a cardiac arrest? So there are factors beyond our understanding. I would say that focusing on your health, focusing on a balanced nutrition, focusing on some form of exercise, all the things which lead to a good, healthy physical body are also the things which lead to a good, healthy mental well being, apart from social support system. But even beyond that, don't think that if you've done all of these things, you're not prone to a problem. I'll tell you another thing. There is a concept known as a prodrome. So, what happens is you could be depressed, but it does not get triggered off, and you could be in that stage for 20 years before it gets triggered. When it gets triggered, we think, okay, what were the recent instances that happened in my life because of which this happened? Little do we know that it was maybe a post traumatic syndrome which got triggered after 20 years. So, again, we are not in the place to judge or diagnose. We are in the process, we are in the phase, to go and meet the right kind of people in spite of all the right things that we do at least once a year. That is the mantra, I think.
So I think it's very important to bring this home in terms of from your point of view, from being a mother, from coming from healthcare industry, and then obviously somebody who's got this very close to their heart. अगर आपको कुछ मैसेज एक्सपेक्टेड मदर्स, पीपल हु आर ईदर थिंकिंग अबाउट प्रेगनेंसी और हु आर गोइंग थ्रू दिस process or the journey of motherhood, how can you kind of sensitize them, encourage them to talk about it a little bit more?
So, I just have a two-liner to that. As a mother, what is it that you wouldn't do for the benefit and the well-being of your child? And if that includes taking care of yourself as a first step, why wouldn't you do it? That's all.
Is there, along this journey of research and been watching organizations, have you seen any bright sparks which kind of gave you a sense of inspiration ki yaar, this is something that is amazing for maternal mental health?
So, I think screening during antenatal period, where this has happened, and a lot of case studies have shown it in some pockets of India, some larger pockets in the Western world where this awareness is more. I think that has been the key because early diagnosis is extremely important. So, as long as we can make that mandatory either from the government side or the private bodies can set up some sort of a system to do that, I think we'll have cracked this to a certain extent.
So, thank you, Dr. Sheenu. I think what amazed me is the kind of effort that has gone to understand this problem from your side in your research. Also was the size of the magnitude of the problem even in the urban India. We talk about that we are developed. It's a free society. We can discuss. Social media is available. Sensitization is there. Being pregnant is not a disease. But there are a lot of other paradigms we often overlook. I would request everybody who knows somebody or is an expectant mother to ask for help, to talk about it freely. Let's try in our small ecosystems to remove this taboo, make sure we have a healthy India. If we have a healthy India, we will have a progressing India. Thank you very much.